Chitrakala?
You're live, sir.
Okay, so shall we start?
Yes.
Yeah, Dr. Shama Sultana, shall we start?
Yes, sir.
Thank you. Dear respected doctors and delegates, good afternoon all. This is Dr. Someshwar from Shield Healthcare. I welcome you all on behalf of Shield for the Adolescent Health YUVA NARI'S Health Care Adolescent Health Week program by Guntur Obstetrics Gynecological Society and YUVA NARI Health Care, supported by Shield Healthcare. And with this, I welcome our today's respected speakers, Dr. Lakshmi SHRIKHANDE ma'am and Dr. PADMINI PRASAD. And I take immense pleasure to introduce our today's host, that is Dr. Muhammad Shama Sultana madam. She's a, can I have the flash CV please? Yeah, she's a young, enthusiastic and cheerful obstetrician and gynecologist, as well as infertility consultant. She is the chairman and co-founder of Hope Fin Hospital and also working as gynec consultant at Star Hospital Guntur. She did her PG diploma in assisted reproductive techniques from Kehl University, Germany, and training in basic ultrasound and endoscopy from Foxy. Also, she has colposcopy expert training from Delhi Gynec Forum. She has been a speaker to Femicide in Community Connect program on preventable women's healthcare held in May 2021. She's a public awareness in charge in Sexual Medicine Committee, Foxy, and editor-in-chief of Dr. Parag Patil's Awareness e-Digest. She also served as a faculty and moderator for Open Forum Awareness on Adolescent Sexual Health organized by POGS in June 2021. She's the founder of YUVA NARI'S Health Care organization in Guntur for adolescent and young women health awareness mission. So with this, I hand over the session to Dr. Muhammad Shama Sultana to take proceedings further. Over to you, ma'am.
Yeah, thank you, Someshwar, for the kind introduction. So good afternoon, everybody. So with very much immense pleasure, I'm starting this session. So first of all, let's play the video of Foxy with all the respect.
Friends, Foxians and women of my country. I am Dr. Shanta Kumari, President of the Federation of Obstetrics and Gynecological Societies of India. As a little girl, I told myself that I have to become something to make a difference. I always believed that if I desired something wholeheartedly, there is a positive force which makes it happen. And here I am, friends, standing in front of you as the 60th President of Foxy, the 38,000 strong committed body of OB-GYNs taking care of women's health in our country. As a young girl, I realized that women play a key role in this world, just like Mother Nature or Stree Shakti as we revere it. It is a guiding force behind all forms of God's creation. And it's only a woman who can actually create a new life.
Hi, I'm Kareena Kapoor Khan and I'm so happy to be here with you, if only on video. Pregnancy is a beautiful experience and I have loved having my babies. I congratulate Dr. Shanta Kumari as taking over the 60th president of this eminent organization.
Stree Shakti is the embodiment of 5 elements: the sky, the air, the water, the earth and the fire. Any imbalance in any of these 5 elements creates chaos and calamities. Similarly, when a woman's health is neglected, it disrupts the universal equilibrium. The intimate link between environment and human well-being is very well known. With increasing awareness of the need for clean water, pollution-free air, and pesticide-free food.
Hi, I'm PV Sindhu. Well, it's such a beautiful feeling for me to be an empowered girl, to be a girl in a nurtured and a safe environment.
Protecting health by preserving nature and its ecosystem is easier than curing any disease. So we have taken up the concept of minimizing the female morbidity and mortality and fetal effects by mitigating the adverse impact of environment. My theme this year goes beyond Foxy's commitment towards women's healthcare. Foxy for all, always.
Foxy for All is another inspiring campaign. What you do in this organization.
After this inspirational message, let's continue further with the YUVA NARI'S video. YUVA NARI'S healthcare video, please play.
YUVA NARI'S healthcare. Who is YUVA NARI? She is adolescent girl and women who are the future of nation. They are in a journey to pursue their dreams. They need courage, determination, dedication, focus, and most important, health. They are surrounded by number of health problems. So here is our YUVA NARI'S healthcare founded by Dr. Shama Sultana, which shall provide awareness by online webinars, health-related videos, offline high school and college health camps, and many more. Our goal is to reach nationwide in 10 years. We need everyone's support. Thank you.
So that's the short intro for our YUVA NARI'S healthcare. So I'm very much glad to welcome you all to the special inaugural webinar of YUVA NARI'S healthcare. And we are glad to do this webinar as a part of Adolescent Health Week under Guntur Foxy Society. And adolescents are the future of nation, and engaging adolescents in programs that seek to enhance their spiritual and intellectual capacities and prepare them to participate effectively in the affairs of their communities is a most significant act of service. Protecting young girls is devised to sensitize gynecologists as well as teachers and parents towards the special health needs of the young, who we feel need a sympathetic understanding and patient counseling on various issues which they face, including health concerns, rather than an impersonal prescription or theoretical lectures from their mentors. We aim to help the young people form a strong moral identity in their early adolescent years and empower them to contribute to the well-being of their communities. Hope with this effort, not only the adolescents, but also their parents and teachers get benefited. So with this, I would like to introduce my speakers and stalwarts experts of today. First speaker, Dr. LAXMI SHRIKHANDE ma'am, MBBS MD Obsgyn, FICOG, FICMU, FICMCH, and she is a medical director, SHRIKHANDE Fertility Clinic, Nagpur, Maharashtra. And she's a chairperson-elect ICOG, Indian College of Obstetrics.
Shama, are you sharing a slide? Then I would like to share. Just a minute. Yeah, can you see? Yeah. Yeah, please proceed, Shama.
Is it shared, ma'am? Yeah.
Yeah.
Yes.
Can you see, Shama?
Yes, ma'am. So our first speaker, Dr. LAXMI SHRIKHANDE ma'am, MBBS, MD Obsgyn, FICOG, FICMU, FICMCH. She's a medical director, SHRIKHANDE Fertility Clinic, Nagpur, Maharashtra. and she is a chairperson-elect ICOG, Indian College of Obsgyn, and national corresponding editor journal of Obsgyn of India, Jogi, and national corresponding secretary Association of Medical Women India, chairperson IMS Education Committee to 2021-23, founder, patron, and president ISOPARB VIDHARBHA chapter 2019 to 2021, president Association of Medical Women Nagpur AMWN 2021 to 2024, Nagpur Ratan Award at hands of Union Minister Shri Nitinji Gadkari, received Bharat Excellence Award for Women's Health, received Mehru Dara Hanstotia Best Committee Award for her work as Chairperson HIV/AIDS Committee, FOXY 2007 to 2009, received appreciation letter from Maharashtra government for her work in the field of Save the Girl Child, Senior Vice President FOXY 2012, and President Menopause Society Nagpur 2016 to 2018, President Nagpur Obsgyn Society 2005 to 2006, delivered 11 orations and 450 guest lectures, publications, 13 national and 11 international, sensitized 2 lakh boys and girls on adolescent health issues. So I'm very glad to introduce you, ma'am, and welcome you, ma'am, as our stalwart and expert speaker today. So thank you so much, ma'am, for joining with us. I'm very glad to introduce you with your very immense CV, and I'm very humble to introduce you, ma'am.
Thank you so much, Shama, for your kind introduction, for your invitation to be part of such a great initiative by Guntur Society and YUVA NARI'S HEALTH CARE. This is the Adolescent Health Week of FOXY, and I'm very happy that Guntur Society has joined hands and has organized this adolescent health program under this theme and this week. And Shama, you have rightly chosen 2 very important burning topics as far as adolescents are concerned. One is PCOS and another one is sexuality. So very good. We will be deliberating on these 2 important issues in today's webinar. Topic of my deliberation is adolescent PCOS. Friends, you all will agree with me that PCOS is one condition where people always like to agree to disagree. Over the years, these disagreements have continued. The criteria for diagnosing this condition keeps on changing. The management guidelines also keeps on changing. PCO is frequently, rather commonly seen in the adolescent girls. Early diagnosis is important because of the potential long-term consequences. But when I am saying this, at the same time, we all clinicians have to avoid over-diagnosis of PCOS, because when she comes and we label her as a PCOS, this label continues with her for her whole life. So I will be telling you the diagnostic criteria according to this latest guideline, which is International Evidence-Based Guideline for the Assessment and Management of PCO, released in 2018 by ISHRE and ASRM at ISHRE Conference, Barcelona. These new guidelines have been designed to provide clear information to assist clinical decision making and also to support optimal patient care. This guideline is the culmination of the work of over 3,000 health professionals and consumers all over the world. So who has formed these guidelines? Friends, remember now this is the guideline which is followed across the world as far as PCO is concerned. So this is formed by the Australian National Health and Medical Research Council through the funded Center for Research Excellence in PCOS and the members of this center who led and coordinated this international guideline effort. The partner organizations who co-funded the guideline are ASRM and ISHRE, and you can see the who's who, the societies who collaborated with these guidelines. You can see Androgen Access Society, Asia Pacific Initiative on Reproduction, that is our ASPIRE, British Fertility Society, our own FOXY, International Federation of Fertility Societies, our own FIGO, the PCO Society, the Royal College, and the list is endless. So all these societies collaborated to come out with an international guideline which is applicable across the globe. So the first thing is how you will diagnose PCOS in adolescent girl. Remember, we have to avoid overdiagnosis, but at the same time, we have to diagnose it correctly as well. We don't want to miss the diagnosis of PCOS in an adolescent girl. The criteria for diagnosis of PCOS, we all know till now we had 3 criteria. NIH criteria, which included all of the following, that is hyperandrogenism, oligoanovulation, and exclusion of related disorders. Rotterdam criteria says that any 2 of the following 3 and she can be labeled as a case of PCOS, that is oligo or anovulation, clinical or biochemical signs of hyperandrogenism, and presence of polycystic ovaries on ultrasound. Androgen Access Society said that all the 3 criteria has to be there, that is hirsutism, oligo or anovulation, and you have to of course rule out the androgen excess or related disorder. Now the beauty of these new guidelines is that it has clear-cut defined the diagnostic criteria to make the life of each and every clinician very, very easy and simplified. The diagnostic criteria taken into consideration are irregular menstrual cycle, clinical hyperandrogenism, biochemical hyperandrogenism, ultrasound and polycystic ovarian morphology. Of course, I will tell you about the ethnic variations and the role of AMH in diagnosing adolescent PCOS. We always talk in a very loose term the irregular menstrual cycle. But this international guideline tells you exactly what we all should mean by irregular menstrual cycle. So it has defined the irregular menstrual cycle for all the clinicians. Remember, the cycles post-menarche, it is in the transitional phase. You can label her as a case of irregular menstrual cycle if she is more than 1 year or less than 3 years post-menarche, and she is getting cycles which are less than 21 days or more than 45 days. That is the cycle, cyclicity of her cycle. If she is more than 3 years post-menarche up to the perimenopausal age, if she is getting cycles in less than 21 days or more than 35 days for less than 8 cycles in a year. So this is irregular menstrual cycle. If she is more than 1 year post-menarche, and if cycle is more than 90 days for any one cycle in a year, then also she comes under the category of irregular menstrual cycle. Primary amenorrhea by age 15 or more than post 3 years post-thelarche, that is after the breast development. If she has not started her periods, then she is a case of primary amenorrhea. With irregular cycles, in this criteria of irregular cycle, PCOS should be considered and assessed according to the guidelines. Please don't label her as a case of PCOS just on the basis of these things I mentioned in irregular menstrual cycle. Now the other criteria is clinical hyperandrogenism. So what you will look for? The comprehensive history and physical examination for clinical hyperandrogenism. In adolescents, it is usually acne and hirsutism. Standardized visual scales are preferred when assessing hirsutism, such as the modified Ferriman-Galway score. A cutoff score of more than or equal to 4 to 6 indicates hirsutism, depending on ethnicity, which I will be telling you in my subsequent slides. It is acknowledged that self-treatment is very common and can limit clinical assessment. So you have to inquire the history of self-treatment for hirsutism whenever you are doing a clinical assessment for hyperandrogenism. There is no universally accepted visual assessment for evaluating acne. The prevalence of hirsutism is the same across ethnicities, yet the MFG cutoff scores for defining hirsutism and the severity of hirsutism varies by ethnicity. As ethnic variation in vellus hair density is notable, overestimation of hirsutism may occur if vellus hair is confused with the terminal hair. So the clinician should know the difference between vellus hair and terminal hair. What are the tests which you will do to find out whether she is having biochemical hyperandrogenism? You have to use calculated free testosterone, free androgen index, or calculated bioavailable testosterone in the diagnosis. Androstenedione and DHEAs have limited role as far as PCO diagnosis is concerned. Reliable assessment of biochemical hyperandrogenism is not possible when the woman is on hormonal contraception. So do inquire for this history as well. Consider withdrawal for 3 months before testing her for biochemical hyperandrogenism. And in this meantime, she can of course use non-hormonal contraception. In diagnosis, biochemical hyperandrogenism is most useful when clinical hyperandrogenism is unclear. So if clinical is present, you are not supposed to do the test for biochemical hyperandrogenism. Now this criteria, this latest guidelines has defined the role of ultrasound in diagnosis of adolescent PCOS. Ultrasound should not be used for the diagnosis of PCOS in those with a gynecological age of less than 8 years. What is the gynecological age? It is less than 8 years after menarche. So up to 8 years of her menarche, you don't need to do ultrasound for the diagnosis of PCOS due to the high incidence of multifollicular ovaries at this stage of her life. The TVS approach is definitely preferred in the diagnosis of PCOS, but you can use this approach only if she is sexually active and if it is acceptable to her, then only. Otherwise, we all do transabdominal ultrasound if and when indicated. Using endovaginal ultrasound transducer with a frequency bandwidth that includes 8 MHz, the threshold for PCOM should be a follicle number per ovary of equal to or more than 20 and or ovarian volume of more than or equal to 10 ml on either ovary. Ensuring you are not considering corpora lutea, ovarian cyst or dominant follicles when you are counting the follicles. So this is the criteria, the number of follicles and the ovarian volume proposed in these new guidelines. In patients with irregular menstrual cycles and hyperandrogenism, an ovarian ultrasound is not necessary for PCO diagnosis. However, ultrasound will definitely identify the complete PCOS phenotype. Transabdominal ultrasound should primarily report ovarian volume with a threshold of more than or equal to 10 ml, given the difficulty of reliably assessing the follicle number with this approach. So how you all should report PCOM? There is a format which has been given in this guideline. The clear protocols are recommended for reporting the follicle number per ovary and ovarian volume on ultrasound. The recommended minimum reporting standards, they include, you have to mention the LMP, the transducer bandwidth frequency which you are using, whether you are doing transvaginal or transabdominal, total follicle number per ovary measuring 2 to 9 millimeter, 3 dimensions and volume of each ovary. Reporting of endometrial thickness and appearance is preferred. Also, don't forget to comment if there you see any ovarian or uterine pathology. there is a clear need for training in careful and meticulous follicle counting per ovary to improve the reporting. Now this question is for audience. If you are very attentive till now, then this is the question for you. The cysts in the polycystic ovarian syndrome are formed by failure of atretic follicles to undergo apoptosis, oocyte proliferation, multiple corpus lutea, or cystic degeneration of ovarian cortex. Those who want can post in the chat box and Shama will see whether you have answered correctly or not. Friends, the correct answer is it is because of failure of atretic follicles to undergo apoptosis. In PCOS, the androgen levels are very high. This prevents atresia of developing follicles, and this forms cyst of size 2 to 9 millimeter in the periphery of the ovary in a necklace pattern. What do I mean by the ethnic variation? Because in PCOS, ethnic variation is important because it is relatively mild phenotypes seen in the Caucasians, higher BMI in Caucasians, especially North America and Australia. More severe hirsutism is seen in Middle Eastern, Hispanic, and Mediterranean women. When we come to our own population, we see increased central adiposity, insulin resistance, diabetes, metabolic risk, and acanthosis nigrans. This is common in the South Asian population. Do you need to do AMH to diagnose a case of adolescent PCOS? No, it is definitely not indicated to diagnose a case of adolescent PCOS. So in a nutshell, I want you all to be very clear with the diagnosis before I go to the management part. Friends, these latest guidelines do endorse the Rotterdam PCO diagnostic criteria in adults, that is 2 of clinical or biochemical hyperandrogenism, ovulatory dysfunction, or PCO on ultrasound. And where irregular menstrual cycles and hyperandrogenism are present, you highlight that ultrasound is not necessary for diagnosis purpose. Within 8 years of menarche, both hyperandrogenism and ovulatory dysfunction are required, with ultrasound not recommended. So if you see irregular menstrual cycle, clinical hyperandrogenism, you can label her as a case of adolescent PCOS, but later on you have to re-evaluate. Ultrasound criteria I tightened with advancing technology, and AMH levels we don't do for the diagnosis of adolescent PCOS. Now you are clear, you have not overdiagnosed, you are not underdiagnosed, you have diagnosed her correctly as a case of adolescent PCOS. So how to go ahead and manage her? The mantra here is lifestyle, lifestyle, and lifestyle intervention. This has been given the greatest weightage in these latest guidelines. So how you can control? You can control your PCOS with lifestyle interventions. So now you will ask me, madam, what do you mean by lifestyle intervention? Because again, it is a very loose term, which we all use it in our day-to-day practice. By lifestyle intervention, I mean healthy lifestyle behaviors, that is healthy eating and regular physical activity should be recommended in all women with PCOS, including those with excess weight, to achieve and or maintain healthy weight and to optimize health and quality of life across the life course. This is also given in the guidelines. This guideline is 200 pages. I will give you reference in my last slide so you all can download and go through the entire guidelines. So now I told you what I mean by lifestyle interventions. But what are these interventions? They are behavioral strategies, dietary intervention, exercise intervention, and obesity and weight assessment and management. Don't forget to assess the impact of PCOS on quality of life. This has been given due weightage and recognition in these latest guidelines. All clinicians should be aware of the adverse impact of PCOS on the quality of life. Health professionals should capture and consider perceptions of symptoms, impact on quality of her life of those symptoms, and personal priorities for care to improve patient outcomes. Like she might be more concerned about acne, other girl might be more concerned about her irregular cycles. So take into consideration what are her preferences and how those symptoms are affecting her quality of life. There are various tools which are available on Google, like the PCOS quality of life tool or the modified PCO quality of life tool. You all can download, keep it in your reception area, tell your paramedical staff to let that girl fill these assessment forms so that you know what is the symptom which is causing greatest distress to her, and you can go accordingly to evaluate and manage that girl. Anxiety and depressive symptoms should be routinely screened in all adolescents and women with PCOS at diagnosis. If the screen for these symptoms and or other aspects of emotional well-being is positive, further assessment by suitable qualified health professional is recommended. If treatment is warranted, psychological therapy and or pharmacological treatment for her emotional part should be offered in cases of PCOS. Factors including obesity, infertility, hirsutism need consideration along with use of hormonal medications, as they may independently exacerbate the depressive and anxiety symptoms and other aspects of emotional well-being. I know in a routine gynec OPD, the clinician is short of time to give such a time for her emotional assessment, but these modified tool forms can help you, and if she feels and you have a look, and you will know how much she is emotionally disturbed by her symptoms and how you should proceed. Now, this is our part, clinicians, the eating disorders and the disordered eating. All health professionals and women should be aware of the increased prevalence of eating disorders and disordered eating associated with PCOS. If eating disorders and disordered eating are suspected, further assessment, referral, and treatment, including psychological therapy, could be offered by appropriately trained health professionals. Now, this was all about eating. What about weight loss? We all see routinely the obese adolescent PCOS, but don't forget you can get a lean PCO as well. So if she is obese, definitely you will prescribe weight loss. But all said and done, it is easy to say, difficult to achieve. So have a SMART goal when it comes to weight loss. What do I mean by SMART? It is specific, measurable, achievable, realistic, and timely. This you have to explain to the girl when you are telling her to lose weight. So how much weight loss you are going to advise her and in what time frame? The achievable goal is 5 to 10% of weight loss in those girls who are having excess weight. And just because she loses 5 to 10% of weight, it significantly gives a significant improvement in the clinical results. 5 to 10% weight loss is considered as successful weight reduction, and this has to be done within 6 months. So this is the SMART goal, that you have to tell her that lose 5 to 10% of weight within 6 months. Now the next question is how to lose weight. Diet. Which diet is best? How much calorie deficit should be prescribed? Friends, all these has been mentioned in great details in these new guidelines. Remember, no one dietary type is recommended in PCOS. I know the Google is flooded with the types of diets which one has to do to lose weight. Tell her that she should not fall trap to all these things. She has to have a balanced diet along with the exercises. To achieve weight loss in those girls who are having excess weight, an energy deficit of 30% or 500 to 750 kilocalorie per day could be prescribed. But whenever you are prescribing this, also consider her individual energy requirements, whether she is a sedentary worker, she is a very active physical worker, what is her current body weight, what are her food preferences, and physical activity levels. So this needs an individualized approach, and it is better to have a dietitian who can help her to formulate a diet chart for her. Now, what about exercise? How much exercise will you recommend for mild weight loss, and how much exercise to recommend for moderate weight loss? In adults from 18 to 64 years, a minimum of 150 minutes per week of moderate intensity physical activity or 75 minutes per week of vigorous intensities or an equivalent combination of both, including muscle strengthening activities on 2 non-consecutive days per week. In adolescents, at least 60 minutes of moderate to vigorous intensity physical activity per day, including those that strengthen muscle and bone at least 3 times weekly. Activity should be performed in at least 10-minute bouts or around 1000 steps, aiming to achieve at least 30 minutes daily on most days, that is 5 to 6 days a week. For moderate weight loss, a minimum of 250 minutes per week of moderate intensity activities or 150 minutes per week of vigorous intensity or an equivalent combination of both, along with muscle strengthening activities involving major muscle groups on 2 non-consecutive days per week, and minimize sedentary screen or sitting time. You can take the help of gym also. So this is the goal if you have to lose moderate weight loss. I know I get many girls and their parents who ask me for any drug, doctor, is there any medication which you can prescribe and my girl can lose weight? So is there any role of anti-obesity drugs? Anti-obesity medications in addition to lifestyle could be considered for the management of obesity in adults with PCO after lifestyle intervention as per general population recommendations. For anti-obesity medications, cost, contraindications, side effects, variable availability, and regulatory status needs to be considered, and pregnancy needs to be avoided while taking these medications. But in a nutshell, I would definitely recommend that please don't prescribe anti-obesity drugs to the adolescent girls. So I covered the lifestyle interventions, the emotional aspect of PCOS in great detail, considering that there are many adolescents and their parents in the audience. Now for doctor friends, let us go to the pharmacological treatment. The first and foremost thing which you have to advise each adolescent girl is to start keeping a menstrual calendar. COCP is our time-tested good option. I will tell you the role of metformin and role of anti-androgens in my subsequent slides. Remember, her immediate attention she needs for hirsutism, obesity, and regulation of menses. But as a clinician, you have to make her aware and her parents about the long-term issues in the form of insulin resistance, the risk of diabetes, cardiovascular risk, the risk of obstructive sleep apnea, and the malignancy risk. It is our responsibility to educate them. Which COCP you will prefer? The COCP alone should be considered in adolescents with a clear diagnosis of PCOS for management of clinical hyperandrogenism or irregular menstrual cycle. Specific types or dose of progestins, estrogens, or combinations of COCP cannot currently be recommended in adults and adolescents with PCOS. This is what the guideline is telling us. So you have to use the minimum possible hormonal dose for that girl. Start with the low OC dose pills. Combined OCP containing estrogen and progesterone given cyclically helps in controlling menstrual problem, hirsutism, acne. Estrogen salt used is ethinyl estradiol. You can decide according to her weight, 20 or 30 microgram per day. Progesterone used are of many types and they have variable effect on acne, weight, hirsutism. So you have to consider this when you are prescribing the OC pills for her. There are many advantages of drospirenone over other progesterogens. It counteracts the water retention due to its anti-mineralocorticoid activity. 78% patients, they actually lose weight or they remain on the same weight. Nearly half of the patients having skin problem or hirsutism, they report improvement, and this is because of its anti-androgenic activity. And women who suffer from premenstrual syndrome also have significant relief with drospirenone. So friends, the guidelines tells us that cyproterone acetate combination is not the first line of treatment when you are treating adolescent PCOS. Now coming to the management of hirsutism, I know I only told you that the self-treatment is very common. So let them continue with the cosmetic measures. She can have other measures also along with temporary removal for the permanent removal of those hairs as well. And your COCP will definitely help her in improving her acne and hirsutism. So when to add metformin for these girls of PCOS? In combination with the COCP, metformin could be considered in adolescents with PCOS who are having BMI more than 25, where COCP and lifestyle changes alone do not achieve the desired goals. Metformin, in addition to lifestyle, could be considered in adolescents with a clear diagnosis of PCOS or with symptoms of PCO before the diagnosis is made. Metformin use appears to be safe in long term based on use in other populations. However, ongoing requirement needs to be considered and it may be associated with low vitamin B12 levels. So if you are giving metformin for years together, don't forget to look for vitamin B12 deficiency and substitute and give her the supplementation for vitamin B12. What should be the dose of metformin? Remember, it has to be adequate. Underdose is not going to help her. The target dose requirement is 1500 to 2500 milligram per day. Clinically significant responses are not observed if you are giving her dose less than 1000 milligram per day. Nowadays, many sustained release preparations are available. You can increase the dose in a stepwise fashion, like you can give 500 OD for 1 week, 500 BD for 1 week, and then once she achieves the minimum daily dose of 1000 milligram, depending on the individual case, you can go on increasing the dose of metformin in a subsequent fashion. When to add anti-androgens for the treatment of these adolescent PCOS? In combination with COCP, anti-androgens should only be considered in PCOS to treat hirsutism after 6 months or more of your COCP, that is your regular COCP with estrogen and progesterone and cosmetic therapy have failed to adequately improve her symptoms. Then you are justified in adding anti-androgens. In combination with COCP, anti-androgens should be considered for the treatment of androgen-related alopecia in PCOS. In PCOS, anti-androgens must be used with effective contraception. If she is married, don't forget to counsel her for contraceptive advice to avoid male fetal under-virilization. Variable availability and regulatory status of these agents is notable, and for some agents, potential liver toxicity also requires caution. So just 2 points on this slide. If she is married, sexually active, you have to avoid pregnancy and don't forget to tell her about the contraception counseling. Does myoinositol, inositol, they has any role in the treatment of adolescent PCOS? Look what guidelines are suggesting. Guidelines are telling you that inositol in any form should currently be considered as an experimental therapy in PCOS with emerging evidence on efficacy highlighting the need for further research. So as of now, the guideline is not recommending you to prescribe myoinositol for the treatment. Women who are taking inositol and other complementary therapies, they are encouraged to advise their health professional. They should tell that I am taking these preparations on my own. Now, this is the SHRIKHANDE very big question. Daily, every PCO girl, every adolescent mother, and in your question box also, there are many questions. Can PCOS be cured? So would anyone in the audience would like to put it in the chat box, yes or no, and Shama will go through it. How many of you feel that PCOS is curable? Or how many of you feel that, oh, I am stuck with it forever? So just put your comments, and meantime Shama sees your comments. I would like to answer this question. Can PCOS be cured? Friends, there is no cure for PCOS. The symptoms can be managed. This is the line which every parent, every girl has to learn by heart. There is nothing in our science by which we can cure PCOS, but we can keep your symptoms under control. So there is difference between cure and control. PCOS is a lifelong condition and symptoms can change at different stages of your life. During adolescence, your features may include irregular menses, weight gain, acne, and hirsutism. Over time, these symptoms may evolve into other health problems, including infertility. When you are married, you want to have an issue. 10% of PCO girls, they do have certain challenges in becoming pregnant. And when you become 40 plus, you have your certain challenges in the form of metabolic complications, diabetes, hypertension, increased risk of cancer endometrium, and altered lipid profile. So this is a lifelong condition. It needs to be monitored and it needs to be kept under control. The common pitfalls from the parent side and from the clinician side is that we fail to recognize the shifting priorities. Discomfort with lifestyle counseling, time limitations are there with the busy practitioners, and failure to emphasize or provide multidisciplinary care with a team-based approach. Because I told you in great detail that we need a dietitian, we need a gym instructor, endocrinologist should be involved wherever you feel like, cardiology, physician. As per our shifting priorities, you have to change on your team member who is managing these PCOS girls. Don't forget to tell them about the late sequelae of PCOS. She is at risk of 7 times more at risk of diabetes mellitus, 4 times more risk of hypertension, lipid profile abnormalities, and increased risk of endometrial cancer should be told to them. These are the common FAQs, Shama, which we will be discussing, I think, in your question series. They have many questions. Will I become pregnant? Will I have problems in my pregnancy? How long I have to take treatment? Am I getting married? What should I tell my fiancé? This we will cover in the question answer session. So to summarize my talk, first and foremost is correct diagnosis and then lifestyle intervention. In the form of dietary intervention, exercise, have optimum BMI, and 5 to 10% weight reduction in 6 months' time is considered as a successful weight loss. Second line management is drugs. Combined oral contraceptive pills are first line pharmacological management for irregular menses and hyperandrogenism, with no specific recommended preparation and general preference for lower dose preparations. Metformin is recommended in addition or alone primarily for metabolic features. Now, this was all as a treating doctor. What you all can do at your level to tackle the menace of PCOS, and here I appreciate, rather greatly appreciate the efforts of Shama and YUVA NARI'S HEALTH CARE, that you have to make a change. If you change nothing, nothing will change. So how you can change the things? Because it is really increasing day by day, the problem of adolescent PCOS. So through your NGOs, or if you don't have any NGO, you are all alone, you can give articles in newspapers and magazines, you can participate in TV shows and tell them to cover the adolescent PCOS. Go to schools and colleges, I know this is COVID time, take virtual programs for them and educate them about adolescent PCOS. Of course, in doctor conferences, we can have dedicated sessions on adolescent PCOS. Nowadays, we have PCO association in our country. if you are very expert in writing blogs, please do write blog in common language so that these girls can read and understand. And of course, those who are research minded, I encourage all those to do research in adolescent PCOS because still we don't have Indian data. Whenever you are approaching these girls through a doctor's platform, doctor's association, as a doctor, it gives a great impact to them and their parents also. Because parents, they say same thing daily. The adolescents, they are reluctant to listen to them. But if you say as a doctor, the acceptance is much higher. So you have to tell them through your messages about the importance of balanced diet, to avoid junk food, the importance of exercise. They are not supposed to be couch potatoes. Every adolescent is supposed to go outdoors and do some or the other exercise. So remember, here I appreciate Guntur OBGY Society, who has come forward in organizing such a great program for adolescent health education, because Doctor Association has a great role, because we say a stitch in time saves 9. So prevention is always better than cure. And here it is the role of we doctors, the Doctor Association, the NGOs like YUVA NARI'S HEALTH CARE. We have a great role as far as prevention of adolescent PCOS is concerned. Friends, this is the link for the guideline. You all can download that guideline and go through it in great detail in your leisurely time. So thank you so much for your patient hearing. If there are any questions, we will definitely answer it after the second talk is over. So once again, I thank the GOGS President, Dr. Chandrasekhar Rao, Secretary, Dr. B. Venkateshwara Rao, and Joint Secretary, Dr. S. Uma Shankar, and of course, Dr. Shama Sultana for organizing this wonderful event and inviting me to speak on adolescent PCOS. And thank you, audience, for your patient hearing. Thank you so much.
Thank you so much, ma'am. A very expected, amazing session. Hope all enjoyed the session. That was very interesting and elaborative and important explanation about adolescent PCOS. Its new guidelines and assessment and screening methods, emotional and lifestyle modifications and nutritional importance in adolescent PCOS, and authentic plan for adolescent PCOS. The questions and queries about adolescent PCOS might have already resolved, but still we shall take few questions asked in the public forum, ma'am. We request you to solve our queries after the second session. So please stay with us, ma'am.
Yeah, I am here.
So with great pleasure, I want to introduce our second speaker, the stalwart expert, ma'am, Dr. PADMINI Prasad, ma'am, MBBS, MD, OBGY, FCS, EPI, DABS, USA, consultant obstetrician and gynecologist and sexologist and marriage counselor. Her credentials are first qualified women sexologist from Karnataka, medical director, Ramamani Nursing and Maternity Home Institute of Sexual Medicine, Bangalore. President, Bangalore Society of Obstetrics and Gynecology, BSOG 2021-22. And theme, Women's Wellness and Illness. Member, World Association of Sexual Health. Chairperson, Sexual Medicine and STD Committee, KSOGA 2021 and 22. Committee member, Sexuality Education, International Society for Sexual Medicine, ISSM 2021-22. Secretary, Council of Sex Education and Parenthood International, CSEPI 2020-2023. National Coordinator, Sexual Medicine Committee, FOXC 2020-22. Co-opted member, National Family Planning Association of India 2021-2023. Secretary, Vice President, formerly Bangalore Society of Obstetrics and Gynecology. Vice President, formerly Family Planning Association of India. Gold medalist, MD Obstetrics and Gynecology, and recipient of numerous awards and felicitations like Rajyotsava, Kempegowda, Rani Chennamma, etc. from Government of Karnataka. Golden Lamp Award, Silver Lamp Award from CSEPI. Author of 11 books on sexual and reproductive health in Kannada and English. Regularly featured on television and radio on sexual and reproductive health awareness programs. Faculty in many national and international conferences of OBGYN sexual medicine. I humbly invite you, ma'am, for this session. So over to you, ma'am, for your talk.
Thank you very much for that kind introduction, and good evening to you all. At the outset, I would like to thank the organizers, Guntur OBG Society and DR.SHAMA for our excellent organization, YUVA NARI. Congratulations to you, Dr. Shama.
Thank you,
for starting this. That is the need of the hour now. So because, and after a very good informative talk by DR.LAXMI SHRIKHANDE, I think that is one thing which adolescents have to know about it and how it affects their self-esteem, body image, and that is more important for them rather than any other medical conditions. So coming to this, my topic, I will share my share screen. I will do that first. So this is another thing which is my theme as a president of BSOG is women's wellness and illness speak the unspoken, because there are so many things which are not spoken and which is still considered a taboo, and the hesitancy and the uncomfortable feeling among those things are something related to sexuality or sexuality education and anything concerned with the sexuality, because it is always anything talked about sex, and sexuality is always thought to be a taboo, obscene and a vulgar thing. But technically speaking or medically speaking, scientifically speaking, how important it is extremely important. Before moving on to my actual topic, so this is regarding our Adolescent Health Committee, FOXY, and Adolescent Health Education or Health, Adolescent Health. This is from 1st September to 7th September is Adolescent Health Week. And in that direction, this is a very important webinar that Shama has arranged. I really congratulate her for that, for highlighting these aspects and also creating awareness amongst adolescents. So this is the theme of FOXY. You all know FOXY for all, always, and DHIRA, especially started by Dr. Shanta Kumari, and which will help create awareness on anything related to the violence that is done on women and girl children. So this adolescence is the beautiful stage of life. Let us talk about it. I bring greetings from Bengaluru. And sexual and reproductive health problems of adolescent girls. Before going on to the actual talk, I just want to highlight some of the clinical situations or the actual things which are the real life incidences or among my patients who have come to me with the problems. I have a helpline, sexual helpline, in that more than 50% of the calls are from school and college students. And I give regularly some programs and television, and most of the viewers are these college and students. They have created a group and they always tell me that any person, any of my friend looks into your program, then all of us will intimate to each other. So the importance of it, so how much they are eager to get information, how much they are eager to know about themselves or their body. The commonest problem in that question is about the body image problem. Just now we heard so much about PCOS. How much of body image problem it can cause? Acne, hirsutism, obesity, and low self-esteem. And recently one girl came, mother brought her, and she said, And she's always looks dull and she doesn't want to mix with her friends. I will not come for any function or anything. Then I asked her, no doctor, everyone will be teasing me. I don't look nice in any of the dresses. So I don't feel like going anywhere because everyone will be teasing me because I am so fat. I have become so fat. And the problem was PCOS for her. And the other body image problems include about the breast size, their height, weight, and the another thin girls. So many thin girls come to me and say, how much I eat regularly and I eat more than so many other girls, but I am not putting on weight. And my breast size is so small and then I cannot wear any dresses. And similarly, I don't feel like going with my friends or attending to any functions. So the other thing is that I also answer so many letters or so many questions written by these adolescents, and majority of letters regarding, there are also the letters which relate to premarital sexual relationship. They say, I got a boyfriend, I was in relationship for 6 months and we had a physical relationship. No, I am so scared. If I get married, what will happen? What I should tell to the boy? And now because I was not knowing anything at that time, I had a friendship and I was misused. What to do? And as a young girl, I had a tuition at home. And then the teacher himself, I was not understanding what it is at that age. But now I know that I was being molested and I was being misused and sexually abused. I am so scared about marriage. I am so scared what to do and what to tell my husband if I get married. So there's so many questions and anxiety related, and these questions relate to virginity, hymen reconstruction, and whether it is possible to create a hymen reconstruction. And you all know, many gynecologists know that more than 10% of abortions are about adolescents. Recently, I got a girl who came, the father is a doctor and only child, and he brought her and said that she is complaining of so much of stomach pain. You please check her. When I saw her, she was 9 months pregnant and she was in labor pains. And the same thing that parents, the father a doctor, both the husband and wife working and going out, and the girl having a separate bedroom and separate bathroom and wearing loose dresses. She was so scared to tell the parents, and she could not avoid. Nature did not avoid that. And she came with labor. This is a true incident, not just a story. So that is how so many of these girls, and especially with so many changes in the society and availability of so many things, pornographic literature, smartphones, internet, and there is so much of information explosion that they have a lot of information. They don't know what to do about that. Anywhere they see surrounding, they have sexually stimulative messages, advertisements, and even in the TV or the cinema or serials, they only be looking at this, which can titillate them, and they don't know what is right, what is wrong. And that stimulates them and they get into sexual experimentation, high-risk sexual behavior. And so many girls, day in and day out, you are just watching in the television or reading in the newspapers how so many girls are faced with rape, sexual molestation, and what is happening to them. So this is the abduction of girls, rape, molestation. This has become a very common thing. So what is the problem with our adolescent girls and what it happened? Whether is it the case only with an affluent and urban and educated people? Whether it is there with other rural children also? Because we have educated, uneducated, rural, urban, and lower class and upper class. And is it the same? Whether the problems are same with all the girls, or is it with only few girls? So that is how all over the world, where they have got all the studies done on this, on the education or sexuality education of the girls, they have seen that those who are well informed, knowledgeable, those who know the risks of irresponsible sexual behavior, they concentrate on priorities of life. They don't take a risk. They will take an informed decision regarding their sexuality and reproductive health. and they will not get into trouble. So that is how the importance of sexuality education. So let us see what is that is affecting our adolescent girls. So you see this adolescent, what are the characteristics? Aggressive, anemic, abortion tendency, dynamic, developing, some are depressed, overconfident, overindulging, and some are obese, loud but lonely, and lacking information, a proper scientific information. They're enthusiastic, explorative, and experimenting. They're social, sexual, and spiritual. They're courageous, cheerful, and they have concern for so many things. They're emotional, eager to get information. They're emulating others. Nervous, never say no to peers. The peer pressure is so strong in them. The temperamental or teenage pregnancy. So a good sexual and reproductive health is a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. It implies that people are able to have a satisfying and safe sex life, the capability to reproduce, and the freedom to decide if, when, and how often to do so. So it has to be a well-informed, knowledgeable decision in these matters. To maintain one's sexual and reproductive health, people need access to accurate information and the safe, effective, affordable, and acceptable contraception method of their child. First of all is that they have to have an access. You all know that how difficult for these children, they cannot directly go to the doctor. They cannot tell the parents and go with the parents because they want to have access. They have got information. They have got access to so many things, but they don't know what is right, what is wrong, what is scientific, what is not scientific. So access to proper information, which is important, and a proper information. They must be informed and empowered to protect themselves from sexually transmitted infections. And when they decide to have children, women must have access to services that can help them have a fit pregnancy, safe delivery, and healthy baby. Every individual has the right to make their own choices about their sexual and reproductive health. So the sexual and reproductive health and rights is the concept of human rights, basically, that is applied to sexuality and reproduction. It is a combination of 4 fields. These 4 fields are treated as separate but inherently intertwined. These 4 fields are sexual health and sexual rights, reproductive health and reproductive rights. The focusing on adolescent sexual and reproductive health is both a challenge and an opportunity for healthcare providers. The society is now witnessing an ever-increasing incidence of unwanted pregnancies, unwed teenage pregnancies, abortions, and their complications, sexual abuse, sexual harassment, addiction to pornography, sexual experimentation, sexually transmitted diseases including HIV and AIDS. Did you know more than half of the world population is under age 25? The United Nations estimates this number to increase to 1.25 billion in the year 2010, which has already occurred, and 1.3 billion by 2020, a 22% increase from 1995. The number of people aged 10 to 19 was 1.1 billion in 1995, but how you can see how much it has increased. 17% of married women aged 15 to 19 use contraception in less developed countries. 15 million adolescent women give birth each year, mainly in developing countries. Infant mortality rate to adolescent mothers is 1.5 times higher than to mothers aged 20 to 29. Up to 4.4 million abortions to adolescent women in developing countries take place each year. 1 in 10 adolescents contracts an STD each year. Half of all cases of HIV infection are in people under the age 25. 20% of adolescents are illiterate in less developed countries. So education is the major factor for these children. So that is the one. Girls' education seems to be the critical factor in many of the positive reproductive health behaviors. You can see this, how common it is. Teenage pregnancy is a socially inflicted health hazard. Children having children, that is the teenage pregnancy. Studies also indicate that Rural Adolescent Pregnancy Project, if they see, the adolescent pregnancy study focuses on rural health, rural youth. Rural teen pregnancy is as prevalent as urban. So it is not only restricted to urban, it is also there seen in rural areas. Be a kid, don't have one. That should be the motto. India is a country of a large population of young people. 30% 10 to 24 years age group, 300 million young people, and among these 40% are girls. So sexual and reproductive health needs remain very high. 50% girls have the risk of getting married before 18 years, 32% girls married by age 15, only 6% adolescent boys get married if you see in comparison. Surveys also show that increasing rate of premarital sex, 15 to 26% young men engage in premarital sexual activity, whereas 3 to 6% of young women engage in premarital sexual activity. Sexual activity starting at a younger age. You have seen in reports that even as young as 12 years, 13 years, the girls have become pregnant because of the premature sexual activity. They are very impulsive. They don't have any knowledge and they practice unsafe sex. High risk of negative sexual and reproductive health consequences are these unwanted pregnancies, infections, unsafe abortions, and physical and mental health problems associated with that. If you come to fertility, adolescent fertility is very high. 20% girls give births before the age of 17. 19% fertility is contributed by 15 to 19 years girls. High maternal mortality and morbidity. Less spacing between children, cannot negotiate number of births or spacing. As you all know, even the woman is aged woman, she cannot negotiate these things with her husband, especially if the husband is a pervert or a drunkard and does not care for the wife, and she has no freedom to decide about the fertility or when to have children or how much to have children, and leave alone. These young girls as obviously cannot have a say in their own body, function. The abortion, 1 to 10% of all abortion seekers are adolescents, 10 to 30% of abortion seekers are young women, 50% unmarried women seeking abortion are adolescents, many are below the age of 15 years. Contraception use is extremely low. Discontinuation rate is very high. Unmet needs of contraception is there. Contraception failure is also very common. Difficult to access healthcare services and information. Services depend on marital status and gender. So if an unmarried girl goes and asks for contraception to the doctor, so many times she may be snubbed and she may have one moral lecture and she may not get whatever that she wants, the protection. So anytime a girl, especially in the government setups, if there is a group of one big crowd surrounding the doctor and one young girl coming and asking the doctor about her problem or whether she is missed the cycle, whether she is pregnant or whether she wants contraception, you can understand how difficult it is for her. So it is not, our health services is also not adolescent friendly and they cannot bring their parents, and the cost of the treatment is very high and which they cannot afford, they will not have money. So there are so many problems for young girls. On the top of it, we also have the PCOS Act, where it prohibits any sexual activity of the girls under the children under 18 years, which is taken as child sex abuse, and they can be punished under PCOS Act. So these are some practical problems which we have. So adolescent reproductive and sexual health services are extremely important. That is included in RCH2 program by Department of Family Welfare, Government of Karnataka. So the managing adults is a teamwork consisting of pediatricians, gynecologists, psychiatrists, sexologists, etc. So the adolescents like to experiment, experience new things. Risk-taking behavior is very high. There is sexual experimentation and high-risk sexual relationship. Human sexuality education, if you come into that, so a proper scientific, age-appropriate, culture-appropriate, value-based sexuality education becomes extremely important to avoid any of these problems in the society for our adolescents. But there is a lot of resistance for a comprehensive sexuality education, thinking that sexuality education means an intercourse education or how the babies are born, and they think that our children are spoiled by the sexuality education. So a proper understanding of what it is and what is there in sexuality education, what they need to know, is all that is very important. The accurate and correct knowledge of sex prevents sexual experimentation, delays the age of first intercourse, safe sex practice, avoids early and unsafe sex. It prevents unwanted pregnancies, infections, and unsafe abortions. The problems of early marriage and early pregnancy. There will be risks of teen pregnancy, poor use of contraception, unsafe abortion, and mortality is very high, morbidity is there. So many children going to the quacks and then going for illegal abortions, they'll end up with trouble and they may die of infection, hemorrhage, and in improper methods of the abortions. So the menorrhagia, anemia, obstructed labor, lower birth weight of the baby, these are all the problems associated with teenage pregnancy. There can be damage to reproductive tract and death of the mother. The 70% of girls of 10 to 19 years suffer from anemia. They already start the pregnancy with anemia, and which continues and can lead to all possible effects. The poor education status. 25% of 10 to 19 years are illiterate. Drop-off rates is very high, 68% from class 1 to 10th class. And especially this COVID time, because of there is no classes, no schools, and only online classes, and the school dropouts are there. And so there has been reports that there has been an increase in the incidence of child marriages or adolescent girls getting married. So that has increased, especially during this COVID lockdown, and which has posed a greater risk for these young girls. Sexual abuse and rape, very high among 14 to 18 years of age. In 82% of the cases, victims know the offenders, but still nothing can be done. They can be abused or molested by the people whom they know, especially if it is in joint families, their own uncles, cousins, and the known family member or the friend can abuse them. The changing trends in adolescent gynecology and various clinical problems, if you take, developmental problems of sex organs, and body image concerns in girls. So whether the body development is normal, genital development is normal, whether there are any growth problems regarding height and weight, menstrual problems are very common during this period. So many do not know. So they also think that menstruation itself is a taboo, and they're scared to tell anything to the parents and scared to come to the doctor, even if they're suffering with heavy periods and anemia and all that. So there can be precocious puberty and PCOD. You heard so much about it just now. And that is a major problem in adolescents, especially these days. The repeated infections, urinary tract infection, white discharge, genital infection, breast problems. Recently, one girl came to me, a mother brought her, she has got a lot of white discharge and some rashes. And when I took a detailed history, she said that she had some physical contact with some boyfriend, and after that she got the infection. That may be the first indication of her high-risk behavior and also some sexually transmitted infections. And many girls also have misconceptions about white discharge. Even the normal white discharge which is there to keep the genitals wet and avoid infections and irritations, that itself they mistake that they have got some problem and they start worrying about the white discharge. Parental involvement. So where we need the parental involvement, what are the issues concerned? Especially when the question of consent comes, identity of the girl, history, proper history not available. So many times the girl may not be able to give proper history, and if the parents are there, especially the mother, can give a proper history. And investigations that are time consuming and also increased cost. So the girls cannot afford themselves if they come straight to the doctor. Monetary issues will be there. time concerns, and diagnosis. What exactly is the diagnosis for the child? The menstrual problems, precocious puberty, delayed menarche, this AUB, now we call it as AUB, not DUB. So PCOD and hygiene problems, hygiene concerns about all these girls. The family exposure, if you look into that, the joint family system is crumbling and nuclear families are increasing. So the natural sexuality education with the children were getting in the joint family by the grandparents, other elders in the home who are keeping a watch on the children and observing them, their growth and their behavior, all that is missing. And only the nuclear families with both parents working are increasing. So their attitude and information changes with the type of the family they have, attitude towards sex, internet, media, beauty consciousness, cosmetics, beauty aids, because at that age, they become very sensitive and they want to look good, they want to have good dresses, cosmetics, they want to emulate other people, they will be watching the heroines, observing them or the friends with the peer pressure. So all these things come into picture at that age. The materialistic attitude is increasing. There is a lot of a generation gap, psychological problems, stress and peer pressure, lifestyle, economic status, nutrition, tobacco, alcohol, substance abuse. If they are into wrong company and if they are motivated towards these things, then again, the problems will multiply. Teenage pregnancy is one of the major problems in the world. Prevalence is 2 to 2.5%. Reasons: early puberty, delayed marriage, early sexual activity, lack of contraception. You all know that girls are maturing early, but the marriage age is increasing because of their studies, going abroad or taking up the jobs. So there is a long period of possible high-risk sexual behavior between puberty and the marriage. Compared to earlier days, there were cradle marriages, young girl getting married. So these problems were not there so much in the early olden days. So now the problems have increased. There will be a lot of physical, psychological, and social consequences about these problems. And nutritional problems in the young girls. The anemia is very common. We all say 12 by 12, at least 12 grams of hemoglobin by 12 years age is important. Malnourishment is increasing. And the biological problems of physical maturity and age factor. The social determinants for their ill health will be early marriage, early childbearing, and lack of education, repeated pregnancies, socioeconomic status, and the gender inequality which is there in the society where girls are looked down upon and even leading to female feticide and other things. The pregnancy outcomes during antenatal, during labor, or during postpartum, there are various complications like anemia, toxemia, obstructed labor, preterm birth, low birth weight babies, and increased problem even for the breastfeeding and puerperal sepsis and other things, and increased mortality and a transmission of infection to the child also. So for the pregnant unmarried adolescents, there will be lack of access to healthcare, lack of antenatal checkup, illegal unsafe abortions, and ill health and increased complications, abortion complications, in addition to various psychological problems. So the prevention of adolescent pregnancy, unsafe abortion, and HIV/AIDS, education is the main factor, main deciding factor, a proper information, access to information, health education, like how now we are giving so much of education and awareness that SHAMA, people like SHAMA having such nice organizations and all the doctors organizations who are giving so much of health education, sexuality education, life skill education. The media plays a very big role, and at the same time media also creates great pressure in the children that are creating what is normal, what is abnormal. And role of healthcare professionals is very important. So imparting education in sexuality is one of the most humane contributions that can be made to the society. Sexuality education should start at home and the school before the child enters puberty. The child has to know what is happening in its body and they are very great physical, emotional, social, psychological changes which occur in the body when the child enters into puberty. So there should be a proper mental preparation to know what is happening so that they can cross this adolescent period in a very good manner, in a healthy manner and a pleasant manner. They can enjoy their growing up periods. So child should be prepared mentally before the changes occur, and the ideal age would then be 9 to 10 years onwards. So topics of adolescent education, what all they need? They should know about the physical changes, mental changes, psychological changes, values about sexual activity, and how they have to control themselves, the sexual energy, till they are ready for marriage, till they finish their priorities in life, like education, hobby, taking up a job, standing on their feet. All that when they finish, then they are completely mature enough to take up the responsibility of marriage and continuing further. So sexual values, attitudes and beliefs, various sexual activities, the adolescent nutrition at that age, and avoiding risky behaviors, and the health adolescent, the sexual reproductive health and hygiene, avoiding myths and misconceptions, then how to look after themselves to avoid sexual abuse, and how to resist peer pressure, how to control it, and how to say no to bad things. That also a life skill. And gender equality, gender bias should be avoided. Gender bias should be avoided. Gender equality should be inculcated right from the young age. And HIV/AIDS life skill education. So these are all the physical changes. I will not go into very much of a detail unless somebody wants it in questions after that. So how the onset of puberty occurs in 10 to 14 years, growth spurt. Only thing is one has to know at that time, it is very important. They are very sensitive about their body. Anybody teasing or commenting on their height, weight, complexion or the weight. So all these things will cause a great depression in the children. So the elders should be very careful in handling the adolescents, not causing any harm to the self-esteem and the self-respect of children. So that is very important. Psychological changes, and there can be with that, there can be sensitivity, the conscious about the body image, and the depression and anxiety can have to be looked into. The psychological changes can occur, they can upset the mood swings, elation, depression, irritation, restlessness, and this is the time of development of self-concepts like self-esteem, confidence, and self-respect. And emerging sexuality. So that is the time the biological maturity and reproductive capability occurs in adolescent period, unlike all the other systems which start right at the time of birth. So because of the hormones, there will be sexual feelings, sexual urge, and they are prone for love, attraction, infatuation, and reading love stories, watching romantic movies, daydreaming. Some may even show more interest in pornography, and the self-love, peer love, or heterosexual. This is the stage they'll first start with accepting their body, and then they're having more interest in dressing up and using cosmetics, using dresses, and slowly that turns into peer love. They're attracted towards their friends, and whatever friends they say, they agree with them. And later, after that age, when they come nearing 16, 18 years, they say heterosexual love starts occurring. That is the time they should know how to manage the sexual feelings, how to sublimate the sexual feelings, concentrating at the diversion with the others, and then they have to look, because they look at the movies and then serials and storybooks, and they think they can do all that, whatever that is shown. So the body hygiene, genital hygiene, taking baths and washing and cleaning the genital, because even now, so many children, so many times, they still have some uncomfortable feeling, handling, touching the genitals, washing it or knowing about it. So that should not be there. So clearings for both boys and girls, the hygiene is important, especially the menstrual hygiene, changing pads and washing and cleaning of hands and genitals, and keeping the genitals clean. And nutrition at this stage, lot of things was talked about this nutrition and lifestyle by the priest. Balanced food and avoid junk foods, and adequate rest and exercise, including yoga and meditation, all these things become extremely important. So there are various health problems for the adolescent, for the girls especially, various deficiencies, iron, calcium, and so many minerals. All this deficiency can happen. Menstrual problems, psychological disturbances, and other things. They have got a lot of misconceptions, myths about body weight and looks, the breast development, genital development, menstruation, and these things about the masturbation also in girls. They have got a lot of questions. So the main thing which is important, which every girl should know, is about protection from promiscuity, irresponsible sexual behavior, and sexual abuse. So they should know, they should be warned that sexual crimes are punishable under law. The 3 R's about sexual abuse: recognize the sexual abuse, resist, and report. Because they should know what is good touch, what is bad touch, how they have to behave, how they have to protect their body, and recognize it. If someone touches the body in the covered parts of the body or in an uncomfortable way, breasts or genitals, they should recognize and understand that there has been sexual abuse. Run away from the place if you are caught alone, and scream or attract attention of other people. Keep on whistle or something so that you can do that, so that you can call somebody and come and report it to your parents or elders at home so that you are safe next time. These are all the various forms of sexual abuse: eve teasing, molestation, rape, obscene behavior, obscene telephone calls, child sex abuse, incest, pornography, and prostitution. The peer love and peer pressure, I told you, if the people of the friends are forcing them to get into smoking, drinks, drugs, prostitution, they should think that they are not friends, they are the worst enemies. So they should understand who are good friends, who are bad friends, and they should know how that can be resisted. Gender bias and gender equality, girls are there in all fields, and they should know that the mutual love, respect, understanding, sharing, and cooperation are very important between boys and girls, and there has to be gender equality. So apart from all this, how they can prevent sexually transmitted infection, what is HIV, how it is spread, and how they can protect themselves will be very important. And the life skill education for them. Life skills are tools to handle and face life boldly, happily, and successfully. These are abilities for positive and adaptive behavior to deal effectively with demands and challenges of everyday life. So they are needed for developing psychological competence, ability to maintain and interact with others or deal with oneself and promote good health. So they are needed to avoid stresses and pressures like peer pressure, media pressure, very high parental expectations, lack of traditional method of passing on life skills from generation to generation, which is very important. All these things can be told in a very confidential, non-judgmental, comfortable setting, devoid of embarrassment, is the one which the children want from the healthcare professionals. So the adolescents are blessed with energy, strength, memory, receptivity, adaptability, vigor, boldness, humor, venture, and many other good qualities. You can see how important it is. So they want an appreciation, encouragement, information. They don't want an abuse or curbing them for everything, and nagging and scolding and then beating. All these things they do. They want love, affection, understanding. So we have to protect the youth. Youth power has to be protected and should not be wasted. They are our future citizens and parents of tomorrow. Thank you very much. So very happy adolescents for them, and a very happy Adolescent Health Week to all. Thank you very much.
Thank you, ma'am. That was a wonderful eye-opener session. Very essential talk for adolescent today. As it's a very undermined problem facing by adolescents nowadays, and adolescent healthcare is a combined approach, and it is an authentic directional speech given by you. I hope surely will help many adolescents, parents, and teachers for their guidance. And so with all my seniors' permission, I will proceed for the much awaited question session. So our first question, can a 15-year-old get PCOS? How is it different from adult PCOS?
This is different from adult PCOS in the meaning that adult PCOS, you can't be sure till she becomes 18 years of age. Because as I told you, up to 8 years of menarche, her cycles are anyway not going to be regular. So this girl, if anyone has labeled her as a case of adolescent PCOS, she should go and reevaluate herself once she is 8 years after menarche to reconfirm that she is a case of PCOS.
Yes. Okay, ma'am. Thank you, ma'am. So, ma'am, our next question, as menstruation is a taboo subject in some parts of India, is there a need to educate adolescent girls about menstruation and menstrual hygiene? Padmini, ma'am?
Yes, definitely. We know because most of the time we look at the urban girls and affluent girls and forget about our rural and less fortunate ones. We still have, there are some places in Karnataka where during menstruation, girls are left alone in a very small hut or outside one village. They have to sit there in 3-4 days, and then they will wash them, give them water and come back. How much the girls are suffering. Those days they cannot even go to school, they don't know what to do, and there's still so many misconceptions which are there with it is an unhygienic thing, and some the things are playing during the menstruation. All these misconceptions are leading to such type of practices. But so now when our Prime Minister Narendra Modi talked about sanitary pads on on this function, Independence Day function. So the major taboo related to menstruation was broken in a very major way. So then you have got movies which are talking about the menstruation and the sanitary pads. And now, of course, it is slowly that taboo aspect is coming down, because compared to the traditionally also some of the Orthodox families were following this. So it is hygiene, they should not touch anything, they should not take bath, they should not eat so many foods and all that. But all that is slowly changing. This is a very natural phenomena of your body. There is no need to have any abnormal feeling about it. And this is now like all the other things, the happy menstruation. So that is all, you can see the TV advertisement campaigns, and we are all part of it, happy menstruation and pride of pregnancy, and so many of these taboos which are slowly breaking up in the society. So still they need, so menstruation is very normal. They can do all the activities, they can participate, go to school, participate in all the sports activities or any other activities. And still traditionally, because some people, they think they are very unhygienic, cannot go to religious places. And that is of course come as a tradition that, so it is left to the individual's opinion of that. But scientifically, it is a very normal function of the body. So they don't have to have any taboo attached to it.
Yes, thank you, ma'am. So our next question is, I'm 16-year-old with irregular periods and also increased facial hair growth. Do I have PCOS? Is it treatable?
Yes, she is
Lakshmi,
definitely a candidate who can have PCOS. I will not say that just because she is having these two things, according to our guidelines, yes, she fulfills the criteria to be labeled as a PCOS. But as I again will say that she is just 16 years, after 8 years of menarche, she should go and get her ultrasound done and get her diagnosis reconfirmed. PCOS is definitely treatable. It is not curable. It is a lifelong problem with you. So you have to be aware of your changing priorities and changing symptoms, and be aware and keep it under control.
Yes. Okay. Thank you, ma'am. The next question. I'm 18-year-old girl studying in a women's college, sometimes attracted to other girls. Will this means I'm lesbian? Is it any mental disorder? Please help. Padmini, ma'am.
Yes. See, that's I was talking about peer attraction and peer pressure. So many times they are attached to their friends so much and they want to stay with them, study together, go out together. Some amount of this is a mental attraction as you are staying together. And some children now, because they are reading so much about this homosexuality, lesbianism and all that, they may misinterpret things. So that is number one. Or there are also girls who really they have got that sexual orientation is different. Some girls are attracted to other girls, so that's why they are known as lesbians. But this has to be confirmed by a counseling with the sexologist or with the psychiatrist. And if they continue with after that, if they have got a feeling to get married to a man and settle in life, have their own family and children, then it is not lesbianism. So there is an attraction to the opposite. It may be a passing phase of attraction to the peers. So because they should not interpret it that way as soon as just because they like some girls, they want to be friends with them. And unless it is a sexual attraction, we cannot call it as lesbian. So that they need not become so anxious just because of some passing feelings in their minds at that age. They have to consult a psychiatrist who can confirm whether it is really their sexual orientation. Thank you.
Okay. Okay, ma'am. Thank you, ma'am. So our next question. Will malnutrition and anemia result in development of PCOS in adolescent girls? Lakshmi, ma'am.
Per se, malnutrition and anemia cannot cause you PCOS, but they are not good. You are in adolescent age group and you have to be adequately nourished. You should have adequate weight. Each and every girl should have hemoglobin of 12. We say 12 by 12. So when you are 12 years of age, you should have hemoglobin of 12. Because otherwise you will get easy fatigability, you cannot concentrate on your studies, you will have dark circles under your eyes. So as such, anemia and malnutrition in general is not good for your body. It will definitely cause menstrual disturbances. So keep it under control and adequately nourish yourself, and you should have your hemoglobin of 12.
With this question, I would like to ask, in our practice also, many of the adolescent girls come in the age group of 15 to 17 or 18 with malnourishment and anemia with irregular periods. How much is related with it, ma'am?
This is not related to PCO. PCO has got a different etiology and different causative factors. Malnutrition and anemia will not cause PCOS, but yes, it will definitely cause her irregular menstrual cycles. And just because she is having irregular menstrual cycles, we can't label her as a case of PCOS unless and until she has a clinical hyperandrogenism, or in the absence of clinical hyperandrogenism, the gynecologist has to do tests, which I have told you, diagnose that she is having biochemical hyperandrogenism, and then only you can label this girl as a PCOS case, because she is bound to have irregular cycles with anemia and malnutrition.
Yes, ma'am. Thank you, ma'am. So my next question, my 15-year-old girl going to give her 10th finals this year, frequently watching some violated scenes in her phone. I got to know when I have seen in her YouTube history. Will it affect her concentration? How could I counsel her without offending her privacy? Padmini, ma'am.
Yes, definitely that will affect her concentration, because sometimes it becomes an addiction. Nowadays we are seeing even the small children all the time playing with their mobile smartphones, and so slowly they start becoming addicted. Recently I had a girl, father came and with that girl and showed all the scratch marks on his body, which was caused by her teenage girl, because she was so much addicted to the mobile. He just took the mobile phone from her and did not give her. So to get back that mobile, that girl, better father and scratched him, and he had so many marks on his body. They can go to that extent. They can become very violent once they get addicted to this. And certainly that watching violence all the time is not good. So first of all, they should slowly tell it in a different way, indirect way, not hurting her sentiments. But if that does not work, definitely she needs a counseling from the psychiatrist, because that can affect the studies. That can affect the studies, and we don't know how it, whether she is doing it with some peer pressure, or friends are watching, or whether she has got any boys who are friends and who are showing all that. So slowly these things are there, which parents will not know what is happening to them. So certainly parents have to watch all these things. And if such a thing is observed, then slowly to tell the girls. And then if that does not work, definitely they should consult a counselor and then look into the problem.
Okay. Thank you, ma'am.
Thank you.
So next question, I'm an engineering student with irregular periods. I get periods in 3 to 4 months, and the flow is continuous for 10 to 15 days, which is really worrisome. I gained 5 kgs in 1 month. How shall I approach about this? Lakshmi ma'am?
Yeah. Definitely, if this history is going towards PCOS, of course, she has not mentioned anything about the acne and hirsutism. But if she is getting her periods in 3 to 4 months, that means these cycles are anovulatory cycles. And because they are anovulatory cycles, she is having flow lasting for 10 to 15 days. You have gained 5 kgs of weight also. So here I will definitely advise you to go to a nearby gynecologist. Don't do self-treatment by yourself, because you need some evaluation and the therapy will be prescribed to you by a doctor. Yes, this indication definitely needs advice of a gynecologist.
Yes, ma'am. Thank you, ma'am. So next question. My 16-year-old sister have a boyfriend since 4 months. I would like to prevent her from further complications in her sexual life. What all I can explain her so that it could help her? PADMINI ma'am.
Yeah, she is only 16-year-old, already a boyfriend. So that is really worrisome. They can be friends. There is no question boyfriend, girlfriend like that. We should tell them, see, you can be friends and have a healthy relationship, but you should always keep a distance, physical distance. And that is the age certain complications can happen. And don't allow your boyfriend or anybody for that matter to abuse you or touch you or behave with you in an uncomfortable way. So you should know what is this sexual abuse and then the consequences. So it can lead to some problems, and then so in a correct manner, they have to understand what is happening and not allow the boyfriend to just, it is a friendly gesture and they like friends, they can be there. So you don't have to say that just a relationship is unhealthy, but they should know how to protect themselves, what is sexual abuse, and how they have to protect, how they have to say no, even if the boyfriend shows some abnormal behavior. That is most important. First of all, at the 16-year-old, first she will be in the nearly 10th or 11th standard. First thing, priority is your studies, not spending your time with other boys or anything like that. And except for certain studies or clarification of your class things, but otherwise you should concentrate on your studies. You should finish it and take a job, stand on your feet, and then get married. That is the main thing, that you should understand the priority. And I had one patient who brought her teenage girl SLC. She was in SLC studying, the same girl. And when I saw that, she was pregnant. She was 3 months pregnant. And asked her what happened. And because that's what mother was telling. Every day I look after my children so carefully. I only go to school, leave her to school, and bring her back from the school. That has been happening regularly because my husband is very strict about my children. And one day, night, when she thought there is the water tap is not closed and water is pouring. So midnight it was, and she went to see what is happening. And the water flow, then she closed the tap. And then she suddenly observed that the door, the lock of the front door is open. Or then she said, what is this? I had night I had closed the door, and why is it that it is open? And when when she went to her daughter's bedroom, she saw that she was not there. Every day night after the parents left, she used to go to there was one construction worker who was staying opposite the house. She used to go to him, spend some time with him, and used to come back. Parents never knew this was happening for so many months. Parents did not know that such a thing was happening. Only a chance detection at that time, so they could make out. By that time, already so much of problem had happened, and she had conceived. So the children, because they are lured by others at that age, whether with the gifts or the dresses, cosmetics, or whatever they say, sometimes even in their house, if they're not getting proper love, affection, that they expect it from someone else. Wherever they get, then they get carried away with that affection, love, affection shown by a stranger. So all these things have to be told, that especially a sister who thinks that a 16-year-old is having boyfriend, that time only she should snub that. That is not correct. This is not the thing. What you are expected to do is to study, and any abnormal behavior with the boyfriend, you should not tolerate, you should come and tell us. So they have to be strict with that, and especially under 18 years, any of the sexual abusers is taken very seriously according to PCOS Act. That also should be told.
Yes, ma'am. Very true, ma'am. Thank you, ma'am. So next question. My daughter is 17-year-old girl with irregular periods, pimples and weight gain. We recently approached gynecologist. She have started anti-diabetic medication. She explained why she has prescribed. But my query is, will my daughter get diabetes sooner in her life because of this PCOS? Lakshmi, ma'am.
Yeah, Shama, I already explained
Yes,
that this girl comes under a category of obese PCOS. So many parents, they have that problem whenever metformin is prescribed, because it is written that it's an anti-diabetic drug. So they get panicky, why my daughter has been prescribed the anti-diabetic drug. So metformin is prescribed to your daughter to help her in decreasing her insulin resistance. Means it will help her in towards PCOS management. It will help her in losing weight. So for your daughter, this anti-diabetic drug has not been prescribed because she is having diabetes, but it is prescribed to help her lose weight, and that she should not develop diabetes in future. So without having any second thoughts, if the gynecologist has prescribed metformin, do give her in the prescribed dosage and for the prescribed duration of time which has been given to you by the gynecologist of that girl.
Okay, thank you, ma'am. Many a times in during practice, it will be very difficult to counsel parents about this anti-diabetic drugs.
Yeah.
So
I know, and we are not routinely doing the insulin resistance and any test, but because she is obese, she is 17 years, so I mean metformin is perfectly justified.
Yes, yes, ma'am. Thank you, ma'am. So, Padmini ma'am, what is the best way to prevent from STD?
Abstinence. Abstinence is the best way to prevent sexually transmitted infections. So even if they cannot do that, the next comes the dual protection for both preventing unwanted pregnancy and sexually transmitted infection using of the condoms. Though of course the female condoms is still not taken up, but at least the male insists that the male uses the condom. But at this age for adolescents, so they should understand that any of this high risk behavior and the sexual or physical contact, especially not only with a single person or with the multiple friends, if they're having sexual behavior, one of the biggest problem, one of the greatest problems is about sexually transmitted infections, including HIV/AIDS. So some of these infections can remain lifelong, can cause menstrual disturbances, the infection extend to the uterus and tubes, even the long-term effect of infertility and other problems, cancer, any of these things can happen. So that should be told to all the adolescents. So high risk behavior, not using any protection for that, and you are causing the infection, especially the sexually transmitted infections, they can lead to all the problems from right from the recurrent genital infections, rashes, ulcers, menstrual problems, infertility, cancer, all the things can happen. So best thing is abstinence is the best thing, and a faithful, that's why ABC, abstinence, be faithful, and use condoms. That's what they say. So that is the best thing.
Okay, very true, ma'am. Thank you, ma'am. So the next question, my daughter is 18-year-old with PCOS. She have an issue with increasing size of breast. Is there any treatment or remedy to decrease the size of breast? Lakshmi, ma'am.
Yeah, here is a problem because what her mother is perceiving as a increasing size of breast is difficult to tell for me as a clinician who has not examined her daughter. Because the breast development is a part of adolescent health growth. So how big are the breasts? Are they really cumbersome? Are they really affecting her self-esteem? And if this is so, then she has to definitely go to a doctor and take a advice. But otherwise, breast enlargement is definitely a part of her growth, physical growth.
Yes, ma'am. Taking a doctor's advice will be.
Yes, actually, Shama.
Yes, ma'am.
Can I tell something?
Yes, ma'am. Please, ma'am.
So there I have seen some of these obese and also the young girls. Sometimes the growth will be so much that it is so much of their size, it is causing the back pain and the neck pain, and then so stooping and all that it is causing. Really, if it is a problem, sometimes we can advise liposuction or then show it to the cosmetic surgeon, because surgeries and other things at that age is not all right, because they have to have their future pregnancy and lactation and all that. But at least with the scanning, if it is showing so much of adipose tissue or anything, so one of the things which they can advise if it is causing any symptoms. So
yes, that is the take-home message, Shama, that she should not try anything on her own.
Yes.
What Dr. Padmini has said, that if it is so big that it is distressing her, then she has to go to a doctor, consult, and then accordingly they should go ahead with the doctor's advice.
Yes, ma'am. Actually, I have put this question because one of the patient came with a really increased breast, bulky breast. Yeah, huge breast. They were using some kind of oils prescribed from some Ayurveda or something to decrease the size.
Yes.
So I advise them it is not the correct way. So
yes, that is the take-home message is go to a doctor. Yes.
Yes, ma'am. Thank you, ma'am. So the next question, will hymen get ruptured with the usage of menstrual cup? A virgin girl can't use menstrual cup? Padmini, ma'am?
Yeah. So usually we say very young girls, we don't advise because they don't know how to use it, and that question will always be there. A small cup, and even then even abroad, many young girls or adolescents are using menstrual cups, but usually they say it's a soft rubber, nothing should happen. But still, if they have got the concern about that, it is better not to prescribe. Otherwise, they may blame the doctor for any future problems. So that some of the virgin girl, after 18 years, I think they can use it if they're, because they are 30, 40, 30 years, 28 years and all that. They can still use it with a proper method and the counseling, how it has to be used. And still it is a very good method of managing the menstruation. Compared to
Padmini, here I would like your comment. This hymen thing is not overhyped by these girls, because even a virgin girl is not going to have the intact hymen all the time. Yes. So I really want you to give the message to the society about how much importance they should give to the hymen.
So see, that's one thing they have to understand. Hymen is just a thin layer of tissue which is covering the vagina, and it has got a central opening for the discharge of menstrual fluid and other discharge from the genital tract. So this development, like any other body organ, can show variations. The hymen can be thick or thin, stretchable or very rigid, and even the opening inside can be very narrow or it can be little loose. So you cannot tell a girl is virgin by looking at the hymen. The hymen can be ruptured due to other activities, sports activities, swimming, riding, and bicycling, or a trauma. Any trauma, if it is there also, it can be broken without the girl having any sexual relationship. Or even if that, even after the marriage, even after the intercourse, hymen can remain intact if it is thin, stretchable. Or the hymen can be broken without having any sexual relation. So the connecting the virginity with the hymen is extremely a wrong thing. So it is not there. The virginity is not in between thighs. It is in between the ears, that is in the brain. That's what they say. Even today, I have seen so many educated people who come and ask me to examine her wife whether she is virgin. So that is I really scold them only and then send them. So that is not the way. See, first thing a husband wife should have is the trust, not about a small tissue. Whether and the girl will be for a doctor. I saw recently a doctor marrying an engineer. How much he tortured her. It was a late marriage, 35 years. She was the virgin only. So there is no problem. But the husband was not at all believing her. You must be having some friends. You are married late and all that. You are her hymen. So he even brought her. Even somebody coming from America also asked me to check his wife. Then I said, no, I am not doing that because I don't have belief in that. So what you should have is the trust with your wife. If you start with that, and if by chance, if she is a virgin, so what will happen? You are starting your marriage with a bad note. So the first day can become a last day. First night can be a last night for you. So that message should go. But at the same time, don't have too much importance for that. And even the boys also should not think, because the boys think they can have 4 or 5 girls, many girlfriends. But the wife, when you ask, I have asked so many boys who come and say, they come for sexual dysfunctions. I have got girlfriend, I have got, I have this erection problem and all that. So I just put them a question, whether you are going to get married to same girl. No, madam, in the house, they have fixed some other girl for me. So you are experimenting with one girl and going to get married with the other girl. If you think your wife has done the same thing, will you accept? They say, no, I will not accept. That is the mentality which we are seeing these days. So that's how it is in your mind. So be that first priority you finish before you get a job, or then before you are ready for a marriage. So then start the beautiful life, because you have got so much of long life in front of you. Don't spoil your life for just a 1 minute of thrill. Don't spoil the rest of your life. Should be the message for them. So that is there. Your sexual relationship, sexual urge, and my relationship with the boys, all that can wait until you get married. So that keep that, all that happiness and pleasure till you get married.
Yes, very well said, Dr. Padmini. You have given a very correct take-home message that presence of hymen or absence of hymen is not a sign of virginity. So everyone should move away from that hymen thing. I mean, all the adolescents and all the adults. And as for Shama using this question, Shama, in Western countries, I mean, everyone is using a menstrual cup. In India, we all have double standards when it comes to having sex. So on one hand, we are a land of Kama Sutra, and when we come, just now Dr. Padmini narrated so many incidences. They are sexually active, but they will not accept, I mean, they will not confide to their parents that they are sexually active. So as a gynecologist, we are in a fix. So we tell them that you only decide. Menstrual cup is definitely cash-free, rash-free, trash-free. Means it is very, very cost-effective. It does not generate plastic waste. And it does not give you any genital part rashes at all. So it's very good. If they can, they should go for menstrual cup. But as a doctor, if anybody comes to me and she's an unmarried girl, I will not tell her. I will give her options and let her choose.
Yes, ma'am. Very truly, relationship should start with that trust, and it will go long run. Thank you, ma'am. So the next question, I'm 19-year-old married last year with irregular cycles. After 1 year of infertility, we approached a gynecologist. She diagnosed it to be a PCOS. She suggested laparoscopic drilling last month. Thereafter, this month's scan, still there is a persisting PCOS with increased size of ovaries. Please suggest what could be done next.
Shama, she's too young to become pregnant. I think she should wait till she becomes 21 years of age. PCOS does cause anovulatory cycles. So this ovulatory dysfunction might be responsible for her not becoming pregnant, as she only said that she is having irregular cycles. There are many options, but first, if she is obese or even if she is not obese, the first and foremost mantra is lifestyle medication, lifestyle intervention, that she should have an optimum BMI, she should have a balanced diet, and even if that persists, before going to laparoscopic ovarian drill, I think there are many other options which you have to discuss with your gynecologist, because I have not examined you. So here I will not be able to give you a clear-cut advice whether you should go for laparoscopic ovarian drilling or not. But I still feel that you are too young to go for a pregnancy. Apply lifestyle interventions and discuss the other options over laparoscopic diathermy with your gynecologist. That is my take-home message to this girl.
Ma'am, will laparoscopic drilling enhance PCOS in some cases?
No, see, she's such a young girl. Laparoscopy being an invasive procedure, I will not advise her. If any 19-year-old comes to me, I will advise a lifestyle intervention. If she's so keen, she's not overweight, I will go ahead and induce her with letrozole. Because the PCO guidelines, which I just now presented, has given us a clear-cut guidelines how we should manage infertility related to PCOS. After lifestyle intervention, first is oral ovulogins. Second line is gonadotropins / ovarian drilling. So, I mean, there is no need to jump to the second line therapy without first trying the first line therapy. So that is what I was encouraging her to discuss the first line option with her gynecologist, because letrozole may give her ovulatory cycles and there are high chances, she being so young, if there is no male factor, I mean, there are all the chances that she will conceive.
Yes, okay. Thank you, ma'am. So the next question, I'm 18-year-old girl with a habit of masturbation. Is it normal to masturbate? Will it affect my fertility later? Padmini, ma'am.
Okay. So there is a lot of misconception about masturbation in women or the girls. Almost 95 to 100% of men, they masturbate. And in women now, with all the studies there, earlier the incidence was less. Now that with their awareness about their body and reading, studying about sexual matters, so that has increased to nearly 60% of the girls or the women masturbate. So that is how, especially the clitoris is the one organ which is creating all that sensation. And masturbation or rubbing of the clitoris or near the vagina can cause the sexual gratification. Masturbation is nothing but the stimulation of one's own genitalia for the sexual gratification. So that is done by so many girls. So many girls come to me and then they tell me, I have masturbated, will it affect my future marriage? Or will my husband come to know something about this and all that? They have got a lot of concern. So if the sexual urge is so much, and if they have discovered that it is going to give some amount of pleasure, so once in a way, if they do it and forget about it, nothing is going to happen. Masturbation is not going to cause any harm for the marriage or for the fertility or whatever it is. So there are a lot of misconceptions associated with that. But only thing which should not happen is that they should not get addicted to masturbation. So the habitual masturbation is bad, because that can disturb their studies, sleep, food, everything, and also cause a lot of psychological distress. So that needs one psychiatric treatment if there is a habitual masturbation or masturbation addiction. Just by masturbating once in a way and nothing is going to happen, they don't have to have worry that it will affect fertility.
Okay, thank you so much, ma'am. As we are surpassing our time, with your permission, can I continue or can, ma'am? Lakshmi ma'am and Padmini ma'am, can I continue?
Or 2-3 questions you can take if you want.
Yes, okay, ma'am. Okay. Lakshmi ma'am, can I continue, ma'am? Lakshmi ma'am.
Some it is freezed. I think she may be having some problem with her net. Yeah, she's come from.
Lakshmi ma'am.
She is joined from another. She has to unmute herself. Ask.
Unmute ma'am.
Unmute Dr. Lakshmi. We can't hear you, Dr. Lakshmi.
Lakshmi ma'am, unmute ma'am.
She is unmuted, but still we can't hear.
Ma'am, we are not able to hear. Ma'am, we are not able to hear you, ma'am.
You can ring her up and tell her.
Yes, ma'am.
By that time, you can take the next question.
Shama?
Yes, ma'am. I can hear you, ma'am.
Dr. Padmini has answered that question.
No, ma'am. We were waiting for you. Will loss of weight correct PCOS?
Yeah, I lost my connection in between. Loss of weight will not cure PCOS, but it will definitely help you to control the PCOS. That is why I am emphasizing again and again that cure and control are two different things. And I have already told you that your weight loss goal has to be a SMART goal. You have to lose total 5 to 10% of your weight loss in 6 months of time. And that is considered as a successful weight loss, and it will definitely help you in having regular menstrual cycles. It will definitely help you in controlling your acne and hirsutism. So if you are overweight, you have to lose weight. How much overweight you are, you only know. You can take the help of dietitian, gym instructors, and your gynecologist. So all three can help you and guide you for the optimum weight loss you have to achieve in your case.
Okay, thank you, ma'am. So the next question, I'm a 18-year-old and had unprotected sex with my boyfriend 1 month before. Then I took a pill after intercourse, but I did not get my period till now. It's 10 days beyond my date. I would like to know what are the safe methods of contraception and abortion. Padmini ma'am.
First of all, she has missed her period. It is 10 days overdue. Then first thing she has to do is to do a urine pregnancy test. So whether she is pregnant or not, that is the. If she is pregnant, then she has to be offered the medical termination of pregnancy. And if it is negative, then we can, once you rule out pregnancy, you can give her some tablet for withdrawal bleeding, because the emergency contraception itself can cause delay in the period. It can cause menstrual irregularity. So that itself may be the cause for her delay. And the main thing is that you have to, any missing period with a sexually active girl, first thing is that rule out pregnancy. Do the pregnancy, take it as pregnancy unless proved otherwise. So according to that, the medical termination, get a scanning done, or what is the duration of pregnancy you can know, and then give the tablets, medical termination. For contraception methods, so they have to, because they don't know that regularly whether they're having the contact, or once in a way they're having contact, whether they're in a live-in relationship. All that detailed history has to be taken before giving her the tablet. So best thing, if the boy can use the condoms for the protection, that is okay. She should insist that he has to use the protection, and without that she should not encourage the sexual relationship. And if they are having regular contact, then you can advise her the OCPs also. So that each time you should advise them not to take emergency contraception each and every time she has intercourse. So that is one thing this so many of the adolescents do not know. Every time they have intercourse, they will take one this. That can cause severe menstrual disturbances and sometimes even lead to ectopic pregnancies. So that is important. The dangers of repeated usage of emergency contraception has to be told to them.
Yes, ma'am. Very true, ma'am. Thank you, ma'am. So the next question, I'm 19-year-old, married for 1 year with one abortion. Now I have a fear that as I was having PCOS, will my next conception stay healthy or there are chances of getting abortion again? Lakshmi, ma'am?
This is a very confused question by the girl because whether she has been already a diagnosed case of PCOS, I don't know from this question. All PCOS, they don't abort all the time. Yes, there are 5 to 7% increased risk of miscarriage if you are a case of PCOS. So you have to be very clear, go to your gynecologist, discuss whether you are a case of PCOS. There are many reasons for miscarriage. So you have to find out what was the specific reason for this miscarriage. Because for all doctors, whether it was spontaneous abortion, it was a missed abortion, it was a threatened abortion, it was an inevitable abortion. So the etiology and further evaluation depends on why this abortion occurred. So from your question, I am not able to tell you that this abortion was because of PCOS only. And even those women who abort repeatedly, they also have 60% chances of having a normal pregnancy and a healthy child without any treatment. So my message is very positive to this 19-year-old girl. Just because you had one abortion, don't panic. You have all the chances in the world to have a normal pregnancy and a healthy child in your next pregnancy.
Yes, ma'am.
But of
Thank
course,
you.
you should get yourself evaluated.
Evaluated. The next question, sexuality education could be started at which age? Padmini, ma'am.
I told that it is the best age is before they enter puberty.
Yes.
Around 9 to 10 years age is the ideal, because after by that time they'll ready to reach puberty. Most of the girls will mature by 10 to 12 years or so. So before that only that has to be started. And once everything is started and got into trouble, and then giving them education is of no use. So that is very important. Awareness of their body, their functioning, the future changes that happen, how they have to cope with that. So all that is normal. Once there is no anxiety and stress for children.
Yes, very, very true, ma'am.
Yes.
So the next question, my daughter is 14-year-old and recently got to know about her PCOS in the scan. Now my worry is, will it affect her fertility in future?
Shama, this is too premature. Daughter is just 14-year-old, means just 1 or 2 year post menarche. So she might be showing a PCO-like morphology. We cannot label her as a case of PCO at this age till she is 8 years after her menarche. So first and foremost, I would like to assure this parent that please don't panic. She can be a PCO-like picture she is having, and fertility is only 7 to 10% of PCO girls, they have problem with their future fertility. I think this is too early. You don't panic. Please don't panic your daughter. Tell her to focus on her studies. PCO is just a lifestyle problem, and if she manages her lifestyle, which I told you, by having balanced diet, having optimum BMI, I'm sure, I mean, sky is the limit for her. So educate and motivate her for her studies rather than you focusing on PCO from this young age and indirectly motivating your girl to focus only on the PCOS. So that is my advice. Please move away from PCOS and focus on the studies. Shama, to mute.
Thank you so much, ma'am. So thank you so much for your valuable answers, ma'am.
Thank you.
Very wonderful session with very wonderful speakers and amazing responses. Hope you also have enjoyed telling us about their queries. It was a very interesting session, ma'am.
Very satisfying. I am feeling very, very happy.
So congratulations to the Guntur Society, Dr. Shama, and your organization and all that. So you have done a very good job of creating awareness, especially in this Adolescent Health Week. So I really congratulate you. I also congratulate Dr. Lakshmi SHRIKHANDE for her such the simple and very information-packed talk about PCOS. Very practical.
Padmini, I learned a lot from your talk, the adolescent sexuality. I mean, wonderful, wonderful, with practical take-home messages to the youngsters and their parents. It was too good.
Thank you so much.
Thank you so much. Our Guntur Foxy Society Secretary and Joint Secretary have already joined, and they have already congratulated me offline. And I'm so happy for this wonderful webinar. And I would like to propose vote of thanks. Before that, in the audience, anybody want to say anything? We have a very nice congratulating messages now. And one question is that.
Divya Narayana.
Yeah, please. Divya Narayana.
Yeah, the Padmini ma'am and Lakshmi ma'am both were really awesome. I really look forward to your lectures, ma'am. Padmini ma'am, we were in Bangalore only, working in command hospitals. Though that day on sexual health also was really awesome. So any patient has sexual dysfunction, can we send to you, ma'am? Like best clinic.
By all means. By all means, I treat all male, female couple. All the cases I treat regularly. Yeah.
Yes, ma'am. Thank you. Really awesome. I really look forward for your lecture, and ma'am. So it was really good.
We awesome have you are a member of BSOG, no?
Yes, ma'am. Yes, ma'am.
And then I regularly sending day after tomorrow. Also, we have got 8th. We have one Master Health series on sexuality. I'll be speaking on diabetes.
Last Thursday, we're telling. First, I could attend. Afterwards, we get any.
Yeah, diabetes and sexuality. I'm going to talk on diabetes and sexualty on Wednesday. So yes. Then there is the program on vagina. So in that time, speaking on vaginismus, theme-based CME is all about the vagina. So vaginismus, I'll be speaking on. So those are things.
Okay, when is it now? Vaginismus?
That is 8th and 12th. 8th I have diabetes sexuality. 12th this vagina theme 10 to 2 morning. Okay. I'll be sending in the groups all that.
Yes, ma'am. Really awesome. It is very less covered. Though we are gynecologists, on sexual health, not much is taught either in DNP, OBG or anywhere. So we are as illiterate as such. But ladies approach us, and we really need to get educated more on that.
Thank you so much. Thanks for your input.
Thank you. Yes, Sunila Naidu, want to say something? Yeah, please, you can unmute and say. Sunila Naidu.
Excellent, excellent lectures by both the speakers. Congratulations to them.
Thank you. Thank you.
Thank you. Thank you. So with this, I would like to propose vote of thanks. No duty is more urgent than that of returning thanks. I feel honored and privileged to get the opportunity to propose the vote of thanks. I especially thank our speakers, Dr. Lakshmi SHRIKHANDE ma'am and Dr. PADMINI Prasad ma'am for giving their valuable time and words of encouragement and guidance to this webinar. And we are grateful for their amazing explanation to all the queries regarding our topic today. We thank you for making us understand and realize few important points about our topic today, ma'am. And I thank all the online delegates who have joined us and made us this webinar a success. And I thank our technical support, Shield Pharma, and their amazing support to giving to this webinar. And last but not the least, my heartfelt thanks to Guntur Foxy Society GOGS office bearers, that is Dr. P. Chandrasekhar Rao Garu, President GOGS, and Dr. B. Venkateshwar Rao Garu, Secretary GOGS President APOGS, and Dr. Umashankar Garu, Secretary APOGS, Joint Secretary GOGS. Thank you so much for joining in and letting us know about adolescent health in this Adolescent Week. Thank you so much. Yes, Lakshmi SHRIKHANDE ma'am, please.
Yes, thank you. I just put a clapping sign for you and for the Guntur Society office bearers. That well done, well organized, well executed, And thank you, Shama, for your invite and for your fantastic follow.
Thank you, ma'am. Thank you. It was a great session and very useful session. Thank you so much. Here we sign off. Thank you.
Yeah.
Thank you. Bye.
Yeah, bye, ma'am. Thank you, ma'am.
Thank
Yeah,
you, ma'am.
and
Ma'am, can I end? Shama ma'am, shall I end the session?
yeah, recording you can stop.
Sure.